Everyone, so just wanted to give a little bit of information before we have our meeting, just in case I miss stuff during our meeting tomorrow on Friday. Hopefully you guys can make it. If not, it's kind of like going to be a catch-all for everything that I kind of wanted to cover. One of the main things that, as you folks know, certification is coming. So please make time for that. Set aside some time. The last week of June, the first 2 weeks of July. So the certifications will come out. Well, AHIP comes out next week, Monday, the 20th. And then the carriers, the insurance companies like UHC and Humana will have their discount code, which I think we should wait for because $50 is a pretty large amount of savings on a $175 certification test. And that's going to be the 28th, 29th is when that link will come out, and the certifications for all the other companies. So if you could take time to do the first couple certifications, let me just pull up the certification list here so you can just take a quick peek again. Remember, we don't need to certify for anyone other than the ones we plan on selling. So for you folks on the Big Island, if you want to do Aetna has the drug plan. That's a really inexpensive drug plan. June 28th. We do have to do Centene Wellcare. That's Ohana. Theirs is a little bit later on July 7th. The next one we have to do, of course, is Humana. Theirs is June 29th. That's when I'll be taking the test. July 6th is Lasso. If you want to do that, that's the Medicare savings account. And then down here is United Healthcare. I feel like I missed one, but let's see. No, I don't think so. June 28th. So June 28th through the beginning 2 weeks of July, I figure, right around this area. So if you guys can aim to get all your certifications done by July 15th, that's probably going to be the most or the best thing, I guess, for us. I think that way we can focus more on the plans and marketing strategies instead of working on certification. So one of the things that happens in news lately, Medicare is back in the spotlight when it comes to things like drugs and the Part B and dental, vision, hearing. So some of the major proponents of the Medicare drug Part D and capping the cost on Part D, they want to have a max out of pocket on Part D, right? We have a max out of pocket for Part C, a Medicare Advantage. They're supposed to put in a max out of pocket, but for Medicare Part D, the drug plan portion, there really is none. And if you look at the numbers, a lot of folks cannot afford to pick up their medications. About 17%, I believe, is the reported amount of people who can't pick up their medications because it's too expensive. With inflation going up and everyone's retirement account going down, I feel like this is going to be pretty drastic for a lot of people who are on more expensive medications, diabetes medications, heart disease, or blood thinners like Eliquis. Those medications are really expensive and have no alternative. The next thing that they talk about in this one anyway is that the dental, vision, hearing. And the main reason why dentists or Medicare doesn't offer dental, according to Medicare and the ADA, is that these doctors that are dentists do not want to make their dental services inexpensive. They don't want to have to negotiate with Medicare to create their kind of fee schedule, because they believe that they're going to have to kind of sacrifice their care or their time. As you know, many doctors are overstressed, see 50 to 60 patients a day. And not only do they have to see the patients, they have to chart it, record it. They have to put, in requests to the insurance company, check on insurance companies, decision on certain procedures. They also have to, see if the test results came in. They have to make time, because if you see your doctor, if you only call your doctor on the phone, there's no billing code for updating your client or updating your patient on the results. And there's no meeting slot for that either in the physician's schedule. They probably call you after hours or during their lunch break. So it is very stressful, and the dental association or groups of dentists, they don't want to do that. One of the, I guess, arguments is, well, you should talk to like a head and neck doctor, because head and neck doctors deal with the head and the neck, which is part of dental. And that's why there's a lot of confusion as to emergency dental care with Medicare. What can they do? And they really can only do emergency extractions, and most times the dentist that does it in the hospital doesn't take Medicare, so you're paying 100% out of pocket anyway. So it is a very complicated problem with no real visible solutions, unless they can make Medicare pay these doctors more, which is obviously not happening. Another thing is that the hearing aid. So according to this report, barely any people use them. So 10% of people who they provide hearing aids to don't use them, and only 22% of patients use hearing aids more than 6 hours a day. So as you know, hearing aids are in the thousands of dollars for good ones, and if people purchase them or are provided them, a lot of those folks don't use them. If you're paying out of pocket $5,000 per hearing aid, most likely you're going to use it, and I believe that's the kind of argument that the Hearing Association, or here it is, like American Academy of Ontario Head and Neck Surgery recommendation. No, that's not the right one. Otolaryngologist. I guess they're part of the head and neck folks too. So it's all kind of in that non or routine benefit and device benefit that Medicare does not cover. One thing I talked about phone, right? So telehealth actually is available, and telehealth is different from like your doctor calling you to talk to you about your test results. If your doctor calls you to schedule, or if the office calls you to schedule an appointment to go over your test results, then that is a billable office visit. So the doctor's office will get paid, and you will have to pay usually a copay. Many times Advantage plans have these at no cost. If they're under original Medicare, they will be billed through Part B. Unfortunately, that's been expanded, so Medicare Part B will have a lot more services, and the doctors will also get more reimbursement than pre-COVID-19. So that's something good. Another thing is healthcare transparency. So the issue here is that some hospitals charge more than others based on location. And therefore it's very difficult to have a federally based insurance program that supports different costing areas, right? Locations. If everyone pays in the same amount, everyone should be able to get the same benefit, and that's not what's happening in the US system. Primarily, in my opinion, is because there are just too many different components. If we just had one major medical insurance and kind of one major health system that ran off the same operating parameters, we would have a little bit more, I guess, fluidity within everything, and everything would be kind of the same. But then that also means that everything is the same. The classic argument of whether or not we should introduce competition into the stream of things, or if we are allowing just one governing body kind of manage and create all the rules and design and implementation of everything. So it's always a give and take. I talked a little bit about running out of money in the stock market. So as you know, inflation report came out. I believe the inflation report came out on Monday, the CPI, Monday or Tuesday. Or was it last week? It might have been on Friday. It came out recently. I don't really know. But numbers are really high, so a lot of your clients might be kind of suffering with their bills. And I want us to make sure that we tell our clients that medical care is really important. It's not more important than like food and electricity for your house. But at that point, there are programs in place to help. And if your clients are in that actual predicament where they cannot afford to pay for utilities, there are programs out there, HCAP, which I believe is the Honolulu, some kind of action program, Hawaii Community Action Program. They help with utility bills, they help with rent. Also, there's always food banks, food pantries out there that they can get food from. And not to not pick up medications. And a lot of times, we have our agents who are wonderful, who can provide guidance to these separate social programs that really help our clients afford their medications, their doctor visits, their rent even. So try and dig deeper if your clients trust you, so that you can get the help that they need. We don't provide them with the guidance of whatever program. We just point them in the direction to let them know that services are available for people in their predicament. Right now, for some people who might have money and are hurting, this is the S&P 500. We're battling 365 right now. Did I say S&P 500? I hope so. It's S&P 500. This is the ETF. So levels on the ETF are important. Levels on the SPX are important. Levels on the ES, which is a futures contract, are also important, even though they're all, unfortunately, different, round numbers. A lot of times these levels will have meaning to people. So we are battling really hard right around here, and to be honest, this is not financial advice in any iteration of the word, but I feel, in my personal opinion, my retirement account doesn't share the same bias as I do, but we do have very, very weak support all the way up until around this level here. So 330, 335, which is another 10% down. I don't see that as being too improbable. In fact, I think it is more probable that we see these levels before we turn around. And I think time and kind of people's assimilation of the data and the economics will change people's opinion and perhaps turn us around. But I really think that this is kind of the level that we have to see hold, and we might be here for a little while before we start going up. I think we'll slowly grind lower, but grinding upwards, I don't think that happens until we hit here. And one of the main reasons I think so is that we have the VIX here. This is the volatility index, and this is called the fear index. Basically, it measures the volatility, so it measures how far up something moves and how far down something moves within time periods. There's a whole equation for it, but basically this is what the index is meant to track: the volatility, the violentness of the swing. And during the COVID highs, it went COVID lows, it went as high as 85. We are hovering around 33 today. We hit 35, but slowly bounced back down. And we haven't hit anywhere above 45 until back in 2020. So our levels are still relatively low. Looks right here, we didn't even hit 40 in the beginning of the year when we had that huge sell-off. So we don't have really that kind of a huge catastrophic event that would have us reset like that. So this is back in 2018, volatility reached 50, and 2015, this is 18, 2015 we hit 50, and 11 and 12, remember what happened in 11 and 12, and then 08, it's up here. So in relation to what has happened in the past, we are nowhere near pain yet. With that said, if clients have money that they want to put into a safer spot, that has actually pretty good benefits. Oh wait, before I go into I'll hit this first. So North American has this awesome product, and the reason I bring this up is because we talk about long-term care and short-term care a lot, and this fixed index annuity actually has those things in it. So it protects you if you have impaired health. If Social Security has reductions, it is an income annuity, so it never runs out of income for you when you turn it on. And it has a death benefit that can be accelerated, that takes advantage of the crediting account versus the actual cash value account, right? So one of the main things is, it can gain value. Your premium credit to the premium credit when you purchase this is 15%. So if you put in 100,000, your crediting account, which is the account that the income and all these other things are calculated on, get a $15,000 boost, 15%. So if you lost 20% in the market, this can kind of help you eke back some of those gains right off the bat. The way that it works is it automatically hits or pushes your money into these 5 different tiering programs by each year. And what this does is it allows the account to grow in kind of tiered time frames. So they have a short-term, long-term, medium-term type of a strategy. This one kind of locks you in there so you can have, you can take advantage of bigger upswings and not be too hurt by quick downturns, right? So every time you get an account credit, your account gets to a lock, and you can actually change the lock at the end of each strategy term. So if the market's going up, it goes down, you might have that down, but as long as that period ends, you lock in those gains, so you can never go back down once you've locked your period. So that's kind of how fixed income annuities work. Again, this is a annuity product, so all the accounts are tax deferred until they take it out. So for how it helps for health impairment rider, I believe it's at no cost. It is pretty much long-term care. So if you can't do 2 of the 6 ADLs, you will get 200% benefit. So let's go here. So if you can't do, where is the 2 of the 6 ADLs, then you can turn this thing on, and it would provide you with 2 times how much you are normally getting. So if you're normally pulling out, let's call it $5,000 a year, just to make things simple, you'd be able to pull out $10,000 a year, right? And the waiting period for this is 90 days, so it's not like instant. It's if you're in the if you 2 of 6 ADLs you cannot do, then after 90-day waiting period, you will get the boost of 2 times. Yeah. Plan gap benefit is a Social Security benefit. So if Social Security runs out of money and your benefits are reduced by more than 3%, the plan gap benefit will provide you with a boost to kind of help you recover from the Social Security downfall, if there is one. Not saying that there will be one, but in case there is one, this is what this benefit does. The enhanced death benefit, so if you decide to, instead of taking your base contract death benefit, which was in this example only $300,000, you can elect the enhanced death benefit, and that'll pay your account, or your beneficiaries $500,000 at $100,000 a year. So this is, of course, it depends on where it's at when you pass, but it does provide you with an opportunity to provide even more money if you are to kind of continue on with the annuity income idea. Right, so that is that. If you want to learn more about this product, let me know. This is kind of what I've been explaining to my clients, because I feel that now is a good time well, actually, this whole the whole year has been a good time to put money into something like this that can keep it safe. You can't lose any money in it, like, so, because if you don't abide by the surrender period and the you take out more than you're supposed to when for taxes, or actually you can't get hurt from taxes. Just the surrender fee can kind of hurt you, but other than that, you can't get hurt as far as what the market does. The very last thing. So Bitcoin. Oh, Bitcoin bounce. It's been bouncing pretty good off the 20,000 level. So Bitcoin has been called an inflationary hedge, and it is not an inflationary hedge. So this is Bitcoin up here at almost 70,000, and since then it hasn't really found its footing. I made a video in February or January of this year about how Bitcoin is going to have a pump and a dump after the Super Bowl, primarily because there's going to be tons of new people who are watching a game that they probably bet on, gambling on, and here's a new thing to gamble on. So it did go up, and then it did just progressively dump even, or go down even harder. Bitcoin, I think, will not see the end of its sell-off until we regain the market, until the S&P 500, and until this recovers, or at least finishes through its kind of sell-off period. So if any of you folks are hearing anything about now's the time to buy, I would be very cautious unless your holding period is 5 years or so, because I think Bitcoin could see 8,000 real quick, and it wouldn't surprise me at all if it continually takes down the market, as the Bitcoin moves has actually been the one to really start off this kind of downward trend. As you can see, right around here, November is where we started our downtrend in crypto, and most likely that's where we started our downtrend in the so right here we had the downtrend. The market came back, but Bitcoin fell, and then everything else kind of followed. Bitcoin represents what a lot of investors consider the risk on mentality. So if Bitcoin goes up, that means investors are taking more risk. When Bitcoin goes down, it kind of cascades. So we have the S&P 500 being the least riskiest asset bundle, the QQQ, which is the Nasdaq, being the next riskiest bubble, or next riskiest asset, and then Bitcoin is the most riskiest asset. And this chart pretty much mimics Bitcoin right here. This is just a channel I drew. I was pretty sure Bitcoin, or not Bitcoin, the Qs, Nasdaq would stay in this channel, and this channel is pretty important as it started off in the March lows, kind of been working its way up, and ever since we broke that, we kind of haven't been able to even get back up in it. So I'm pretty sure we are going to have to work a bit. This level here is probably going to hold a little while where it's at right now, but I'm almost certain that we're not going to come back up unless things happen that are going to be, I guess you could call it, economic changing. So that's that. This is just some ideas that I follow. If you guys wanted to learn more about this stuff, I do have a course on this that I actually teach about technical analysis, but I don't think that's really important. My main thing today is to just let you guys know kind of the overall market sentiment, the opportunity with annuities, and how annuities can help kind of smoothen out this this problem of selling off, going down. We can lock in those gains and then grow back, right? So it does provide a lot of opportunity for you folks. Also, this kind of piggybacks on the long-term care, short-term care products that we've been talking about lately, and it will provide us with kind of another thing to talk about if you want to explore it. You don't have to. This is just what I like to do because I feel bad for all my wife's coworkers who have to work an extra couple years because, you know, a 20% downturn in the market, they're talking about losing like $40, $50, $60,000 just in this last move. So that can, I mean, to get that back, you don't even know if you will, right? Because like I said, the market, I feel, will continue to sell off at least for another, till we hit the 3,300 levels, and then we might come back up. But everything right now is very unhealthy looking. Some companies have actually failed recently, laying off people and such because of their, I don't know, economic things, and having all these companies being so highly correlated with each other. Anyway, stop talking. You guys have a good day. Hopefully I'll see you folks in our meeting. For those of you who are still here listening and you want to learn more about Medicare, want to learn more about products like this, send out an email, reach out to me, and I can definitely help you. If you're an agent, or if you're interested in getting these products or learning more about how Medicare affects you and your Medicare plan, you can go ahead and email me. Same email down in the YouTube description, matt@planetadvisorshawaii.com. Look forward to hearing from you. Stay safe. Have a great weekend. And I'll see you later.